Hello. Okay, so this is my final study guide for anatomy. And we got all this information, 40 PowerPoint slides of information on Tuesday. And right now I'm testing myself. It's my fourth day testing myself. And let's get started. So we have the pituitary gland here. We have superior hypophyseal artery, inferior hypophyseal artery. This is the anterior lobe of the pituitary gland, posterior lobe of the pituitary gland. And right here in the bottom are some hormones. So posterior pituitary secretes oxytocin from the periventricular nuclei and ADH from the supraoptic nuclei. The anterior pituitary lobe secretes growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, luteinizing hormone, follicle stimulating hormone. And there's another one right here, as you can see, and prolactin. Yeah, so those are that one. Thyroid gland, we have the hyoid bone, the right lobe of thyroid gland, middle thyroid vein, the right common carotid artery, the thyroid cervical trunk, the trachea, outline of clavicle, outline of sternum. We have thyroid cartilage of larynx, superior thyroid artery, internal jugular vein, superior thyroid vein, cricoid cartilage of larynx, left lobe of thyroid gland, isthmus of thyroid gland, inferior thyroid artery, and inferior thyroid vein. So internal jugular vein, right common carotid artery. Okie dokie. Pancreas and adrenals. Okay, this one usually takes me a little while to get through. Let me see. So we have the right renal artery and veins, the right adrenal vein, right adrenal gland, inferior vena cava. We have the right and left phrenic arteries, right and left inferior phrenic arteries, left adrenal gland, left inferior phrenic vein, left inferior adrenal artery, left adrenal vein, left kidney, left renal artery and vein, abdominal aorta, inferior vena cava. Okay, over here I like to start on this one, the hepatic artery, and then portal vein, inferior vena cava, left adrenal gland, splenic artery, spleen. Right here is a tail, right here pancreatic neck, and then the head. Here is the left adrenal gland. Left kidney. And then here we have superior mesenteric artery and vein, abdominal aorta, inferior vena cava, uncinate process, second part of duodenum, major papilla, minor papilla, right kidney, right adrenal gland, common bile duct, and then hepatic artery, portal vein. Okay. Okay, female reproductive system. We have the body of uterus, cervix, vagina, rectum, greater vestibular gland, paraurethral gland. We have fallopian tube, ovaries, fundus of uterus, urinary bladder, pubic symphysis, clitoris, urethra, labia majora, labia minora. Okay. Male reproductive, we have the ureters, pubic symphysis, urinary bladder, seminal vesicle, ejaculatory duct, prostate gland, corpus cavernosum, corpus spongiosum, urethra, glans penis, and external urethral orifice / urethral meatus. Over here we have rectum, anus, bulbourethral gland or Cowper's gland, and then right here bulbospongiosis, vas deferens, epididymis, scrotum, testes. External urethral orifice, urethral meatus. Okidoki. Corpus cavernosum, corpus spongiosum. Renal system. We have right and left adrenal glands, inferior vena cava, right and left renal artery, right and left renal vein, iliac crest, right and left common iliac arteries. Over here we have the diaphragm, esophagus, the spleen, abdominal aorta, right and left kidneys, right and left ureters, rectum, urinary bladder. Okay, common iliac artery, right and left. Gastrointestinal. We have the mouth or oral cavity, the larynx, trachea, esophagus, liver, bile duct, gallbladder, duodenum, jejunum, ileum, rectum, anus. Right here are the salivary glands. We got the parotid gland up here, sublingual gland, submandibular gland, the pharynx. Then we have the stomach, pancreas, transverse colon, descending colon, ascending colon, the cecum, sigmoid colon, and appendix. Okay. And we have stomach and colon. We have lesser curvature, cardia, fundus, body, rugae, greater curvature, pyloric antrum, pyloric sphincter, appendix, ileocecal valve, haustra, hepatic flexure, splenic flexure, epiploic appendages, and tenia coli. Hepatic flexure, splenic flexure. Yep, hepatic flexure, splenic flexure. Okay. Now we move on to the 38 or 32 stain slides. So in the test, we're not going to be given this. The word bank is going to be all jumbled up in one page, in the front page. So I cross this out to study like the terms to make sure I know them without looking at a word bank. Pituitary gland, this one, anterior pituitary lobe, posterior pituitary lobe, pars intermedia. Okay. Pituitary gland, anterior pituitary lobe, posterior pituitary lobe. This one's also anterior pituitary lobe and infundibulum. Pars nervosa, pars distalis, pars intermedia. Pars intermedia. Thyroid gland. Okay, I know right here is follicular epithelium, thyroid follicles, colloid, follicular epithelium. Okay. Thyroid gland, thyroid follicles, colloid, follicular cell nuclei, and parafollicular cell. Parathyroid, thyroid gland slide. We have parathyroid gland right here, thyroid gland here, connective tissue between both glands, thyroid follicles, and colloid. Right here is the adrenal gland slide, adrenal medulla in the middle, adrenal cortex on the outside. Adrenal gland slide, we have adrenal capsule right here in the edges, adrenal cortex here, outer side, adrenal medulla right here, and then blood vessels right here. Adrenal gland slide again. We have adrenal medulla right here, adrenal cortex with its 3 zones, the zona reticularis, zona fasciculata, zona glomerulosa, and capsule. Pancreas slide, pancreatic acini, islets of Langerhans, and capillaries, but in this case it's going to show blood capillaries. Female reproductive system, so corpus luteum, medulla, cortex, follicles, tunica albuginea, follicles, cortex, yep. Ovary slide part 2. We have primary follicles, primordial follicles, oocyte nuclei, tunica albuginea, and germinal epithelium. Fallopian tube, uterine tube. We have lumen, mucosa, muscularis, serosa, blood vessels. Muscularis, serosa. Yep. Fallopian tube. We have lamina propria, lumen, mucosal epithelium, ciliated cell nuclei, and then non-ciliated, in parentheses, PEG cell nuclei. Uterus slide, perimetrium, myometrium, endometrium, stratum basalis, stratum functionalis, perimetrium. Okay. Mammary gland slide, lobules with ducts, adipose tissue, loose connective tissue, dense irregular connective tissue. Testes slides, epididymis, seminiferous tubules, tunica albuginea, testes. Seminiferous tubule slide. Right here are the seminiferous tubules, this whole thing, then the lumen, then the spermatids, the Sertoli cells, spermatocyte, and spermatogonium. Epididymis, we have stereocilia, smooth muscle, pseudostratified columnar epithelium. Vas deferens slide, pseudostratified columnar epithelium, smooth muscle, sperm, and lumen. Oh. Prostate gland slide, simple columnar epithelium, lumen with prostatic secretions, fibromuscular connective tissue. Renal cortex slide, renal corpuscle with glomeruli, renal tubules. Juxtaglomerular apparatus slide, juxtaglomerular apparatus, distal convoluted tubules, proximal convoluted tubules, Bowman's space, Bowman's capsule, renal corpuscle. Renal medulla slide, thick and thin portions of the loop of Henle, collecting ducts, vasa recta. Ureter slide, lumen, transitional epithelium, adventitia, muscularis, in parentheses, smooth muscle. Okay, urinary bladder slide. We have transitional epithelium, nuclei of transitional epithelium, basement membrane, and smooth muscle. Tongue slide, skeletal muscle, lamina propria, stratified squamous epithelium, and filiform papillae. And skeletal muscle for swallowing. Okay, so mandibular gland slide, serous acini, mucus acini, excretory ducts, connective tissue. Esophagus slide, muscularis, submucosa, mucosa, lamina propria, stratified squamous epithelium. Stomach slide, chief cells, parietal cells, gastric pits. Oh, where did they go? Small intestine slide. Okay. We have muscularis, submucosa, Peyer's patches, and villi. Submucosa, muscularis, Peyer's patches, yep. And then the final slide, 40. We have the colon and large intestine slide. We have the muscularis, submucosa, mucosa, goblet cells, lamina propria, and intestinal glands. That's everything, and our final is next Tuesday. So I'm just gonna be reviewing this every day for like 15 minutes, like however long this recording is.